Medical professionals have warned that nearly half of suspected endometriosis cases are initially misdiagnosed, with many women waiting years before receiving proper treatment. Speaking at the Healing Mama Africa boot camp in Kirinyaga, specialist Dr. John Jagi noted that stigma and misconception often lead to women's pain being dismissed as normal menstrual discomfort.
We have patients from, across Kenya. We also have patients who have come from Nigeria who are going to benefit from this initiative. We have a patient who has, traveled from Cameroon. So this is not only Kenya. I think I would say it's beyond Kenya. So this week we are going to perform more than 100 free ultrasound scans. And we're also going to perform more than 20 endometriosis surgery. And these are not just endometriosis surgery, these are complex endometriosis surgery. So there are going to be patients who are benefiting from this initiative, but this initiative in itself only should act as a platform for awareness, and that we need to change our practice. We need to create more awareness. We need to train more specialists, and we need to be intentional about improving care for endometriosis and oncology for sure. That 1 out of 10 women suffer from endometriosis globally. Unfortunately, we don't have this data for Africa. Secondly, we know that there's delayed diagnosis in endometriosis, and Western data shows that can be 8 to 10 years. Now, we are seeing very interesting presentation among women from Africa, and that is their delay could be anywhere from 10 to 20 years. And one of the main challenges, of course I know it's a global problem, but I think in Africa it's even worse, is access to diagnosis and access to treatment, because treatment for endometriosis, especially surgical treatment, is quite extensive and it needs multidisciplinary. What we mean by that, you need to have teams working in collaboration, because there are patients who might present with endometriosis of the bowel, endometriosis of the bladder, and this just touches different specializations. So that's what makes it very complex. And up to now, we'll say there are still very limited facilities that are offering care for endometriosis.
I've been there, and I know that painful menstruation is not normal. I've undergone through challenges, being misdiagnosed, taking so long before knowing if it was endometriosis, but later on I was treated.
Experts also cite a shortage of trained specialists and limited access to diagnostic tools as key challenges, especially in rural areas.
Endometriosis is definitely a major challenge in terms of quality of life, in terms of fertility, definitely, in terms of even mental and psychosocial aspects. So it's not only a disease that interferes with pain, or it's not just any other disease, it actually messes their life and turns them upside down, many of them going into suicidal tendencies. So once these women feel heard, and we are in a position to now see how to help them, I think the whole narrative will change soon.
The week-long bootcamp is expected to provide over 100 free ultrasound scans and conduct more than 20 complex surgeries, offering relief to patients from across Kenya and beyond, while also raising awareness about the condition.
This week we are going to perform more than 100 free ultrasound scans, and we're also going to perform more than 20 endometriosis surgery. And these are not just endometriosis surgery, these are complex endometriosis surgery. So there are going to be patients who are benefiting from this initiative, but this initiative in itself only should act as a platform for awareness, and that we need to change our practice. We need to create more awareness. We need to train more specialists, and we need to be intentional about improving care for endometriosis and oncology for sure.